This video is about living with chronic pain. There's things that you can do to kind of reduce that experience. There's things you can do to cope. And there's this interesting roundabout way of potentially decreasing the intensity of the pain. So let's start with that one, because that's going to be the most disbelief. Like, wait, what? You think you can reduce this pain? This is physical. How could anything psychological help? I'm glad I asked. So, let's take anxiety. Anxiety causes flare-ups for like rheumatoid arthritis, fibromyalgia, other autoimmune diseases which cause pain. Well, interesting thing, they've done studies with reducing anxiety with fibromyalgia, and when they used EMDR to reduce that anxiety, the fibromyalgia was less painful. Internal family systems therapy was used with people who had rheumatoid arthritis. And guess what? It reduced pain from that. Weird, right? But it makes sense. If anxiety exacerbates something, then we reduce that thing that makes this thing that's there, and it's going to stay there, just not trigger it as much or as intensely. Cool. That can be helpful. So there's some therapies you could utilize that could potentially be helpful. There's even studies with hypnosis and pain. Interesting stuff. But then there's also things you may have never ever thought of, like couples therapy. How would that work? So Sue Johnson did a study where they took couples who were fighting, a husband and wife. They got the wife, they put electrodes on her, and they gave her an electric shock, and she measured her pain. Stranger came in, held her hand, pain was a little bit less. Husband came in, held her hand, pain skyrocketed. Brain was saying, he's not safe, watch out. This was when they had insecure attachment, but after going through couples therapy, there was secure attachment. They repeated the experiment. Got an electric shock, the baseline, that pain. Stranger held her hand, went down a little bit. Husband came in and held her hand, and the pain dropped a lot. Now the brain was saying, it's okay, you're safe, he's here for you, you're loved. And the experience of pain was less. So, couples therapy, interestingly enough, this roundabout way, it could reduce pain, but we see this. You've likely seen this. You've perhaps seen a child scrape their knee and run up to a parent, and the parent kisses their knee, and then they run off as if they're not hurting anymore. That's because of secure attachment. That experience of pain is actually less after that. Interesting things. Let's move on to mindfulness. Now, if you have pain and you've heard people say, oh, do mindfulness meditation, that'll help, and it kind of ticks you off, then you're probably going to want to stick around. Because who would want to actually be mindful of their own experience when they're in pain? That seems awful. That seems terrible to be paying attention. But it's what you pay attention to. So if you're mindful, you take a bite out of something, you are mindful of how it tastes, you're paying attention to something. That's mindfulness. It doesn't have to be meditation. It could be just something you're choosing to pay attention to. So mindful exercises can still be helpful, whether it's mindful eating or you just guide your attention to some other part of your experience, because you're experiencing multiple things at one time. You might be in pain, but you also might feel something else or think something else. You can sit with that. You can write in a journal, and you can end your journal with things that you were grateful for. You paying attention to that part of you that is grateful. So whether it's a journaling exercise, a mindfulness, you're choosing what else to pay attention. I say what else. It doesn't dismiss the fact that you're in pain. It doesn't invalidate anything. It's just adding and it's not neglecting this other part of you. Your pain may be so loud that you may not be paying attention to other parts of your personality, who you are, other emotions. Mindfulness can help. Journaling can help. These things can improve quality of life, whether you go the route of therapy, you go the route of journaling, or just coping, or living with something, and just adjusting to it, I suppose. Just make sure you pay attention to other parts of your experience so that you can be balanced. I hope this has been helpful. And I hope this has brought insight. The point of me saying this isn't to say, oh, you're in pain, you should go see therapy or a therapist. You obviously have this in your head, it's all in your head. No. I would never come at it from that approach. It's a very real and physical thing, chronic pain. So it's just one of those things where indirectly, because our body and mind are connected, kind of treat this one thing, you can affect something over here. That's it. But offers a little bit of hope. Just a little bit, or rather an experiment. Maybe don't have hope. That's up to you. Maybe just try it as an experiment. See if it works. If it doesn't, so what? But there's the journaling exercises, connecting with people, being grateful for things. There's also exercise. And when I say exercise, I mean movement. I don't mean like high intensity, because if you're in chronic pain, you probably want to avoid high intensity exercises. But if you walk a mile, it's still a mile. You don't have to run it. You don't have to sprint it. You can walk, right? And if you can't, something you can do. Any sort of movement. It's helpful. It gets the blood flowing. These are some things that can help with living with chronic pain. I hope I haven't ticked you off too much, and I hope something in here was helpful. If so, please click like, subscribe.